Okay, everyone, thank you for coming to the Choosing Wisely November webinar. Firstly, I'd like to begin by acknowledging the traditional custodians of the lands that we're on today and pay my respect to the elders past, present and future. So it's with great pleasure that I hand over to Dr. Lisa Rasmussen, and she'll be talking about environmental sustainability and how it can fit into choosing wisely at your health services. I'll pass over to you, Lisa.
Thanks very much, Anne-Marie. So look, today I think I did give us a rather lengthy topic, how a strong Choosing Wisely program can be a powerful tool to help a hospital reduce its carbon footprint, be more environmentally sustainable and build a broader global ethical practice. So here goes. Now, I just think this is really a major acknowledgement to the beginning of the Glasgow COP26, which, as everyone would know, are the United Nations Conference of the Parties conferences on climate change. I was fortunate enough to go to both the COP21 in Paris and then the one the following year in Morocco. And I'm really just acknowledging that Glasgow now is 6 years on from Paris, and it is the key one where we as a whole globe need to really set our serious targets and have quite an ambitious and broad program of change. I think one of the things I did really came home to me having the chance to go to two of the COPs was that seeing the world's people come together and be arguing so forcefully and eloquently the need for us all to look at so many big issues together to address environmental issues and climate change. So that acknowledged, I think what's at the core of what I'm trying to talk about today, and I'm going to take you through what we've done at the Mercy in developing a strategy, a very broad-based strategy. And I think to preface that strategy and then to go into what could Choosing Wisely do, I just thought it was worth a bit of a beginning list of the things that I think we just cannot ignore anymore. We can't ignore the climate crisis. We cannot ignore the degradation of the environment. We can't ignore, and I think the other thing is people are ready not to ignore these things more and more. We can't ignore national and global inequality, the situation for Indigenous people and Indigenous empowerment. And I think particularly one I wanted to keep returning to as well for this talk is a deeper understanding of the impact of the things that we buy on the world's people and on the planet. And obviously waste is part of that. So the first bit of this talk's a little bit of a story through how the Mercy's Care for People and Planet strategy has come about as a broad-based approach to healthcare to address climate change, to try and address climate change whilst also not ignoring those things that we were just talking about. Now, I became involved partly because I was just sort of working at Mercy at the time, and that I'm a hybrid medical doctor and environmental master's girl. And so I remember at the time, it was 2015, so the same year as that the Paris COP, and Pope Francis had just published one of his encyclicals, and it was called Laudato Si, which I'm sure many of you are familiar with, on care of our common home. And I was a young girl who was raised Catholic, and I must admit I did get a lot of enjoyment out of wandering around saying to everybody, well, the Pope says what, and we must do it. One of the things that encyclical letters are almost a mandate to the people to act. And it was a very, very valuable and important opportunity to give gravitas within, a Catholic organisation like Mercy to take stock and think about what the Pope Pope Francis was trying to say. So one of the things that Pope Francis was saying then and has continued to say is, for us, we have to understand that things are connected. And that's kind of a challenge in a post-colonial, late capitalist world where we tend to not do that. And I think Pope Francis was saying, unless, and I've got them there in blue, they were sort of 6 of his key pillars, saying these things have to be addressed together. You can't address climate change without looking at loss of biodiversity, pollution and waste, breakdown in society, global inequality, and obviously water as well. And much of what he was saying was very aligned with the Sustainable Development Goals, which I know you would all be so familiar with, and so much of the really wonderful work that's been going on in the NHS Sustainable Development Unit over the last at least a decade and more. So what happened was that I went to the CEO of the day and just said, would now seems a good time. We might be able to really make a difference. And with one of the women on the exec who was head of leadership and mission, this sat under her. So together with a few of the key workers on the ground at Mercy, we developed a case and took it to the board. And I was given a day a week initially to try and develop a strategy for Mercy. So that's what we've done. So I'm just taking you through that phase of it, and then we'll get on to Choosing Wisely. So I guess just briefly touching back on Choosing Wisely, it must have been an important year, 2015, because at the same time as Laudato Si, Choosing Wisely was launched in Australia. And I've just put up, the big goal that all of you would be familiar with, which is our goal for Choosing Wisely. And so I think as I was sort of starting that big collaborative process and working with Julia Trimboli on exec to do so, I started to hear more and more about Choosing Wisely and started to think, you could broaden an idea of Choosing Wisely and it could fit to nearly everything, in an ambitious project like what we were thinking about. I think what I loved about Choosing Wisely was that it was a national initiative. It very rapidly had broad support both within the health system and in the community. It was evolving in its breadth of focus, and I could see that progressively with each year. It was firmly evidence-based, was led by change agents on the ground, and so many good clinicians and people from all different professions with such good ideas and knowing what needs to change. And just a solid emphasis on improving quality of care and harm prevention. So I just always thought, every strategy is going to need a set of tools or approaches that are going to enable you to operationalise something. So I had my eyes on this from the very beginning. So that's where I was always sort of thinking quietly in my own, in my own mind. So just as a little bit of just some prefacing before I just give you a brief rundown of where the strategy landed in the end. I think, at the time, Mercy, we've got 2 big hospitals. I'll go over just the scope of Mercy in a minute, but we were at that point quite slow to really get going on. We didn't have an environment officer at the time that I started, and many hospitals had, but I was fully aware that not just health, but most of our attempts in terms of thinking about climate change were really only focusing on what now we call Scope 1 and Scope 2 emissions. And I've listed that there for people to be reminded of. And just through all the work that I immersed myself in from the NHS, it was increasingly obvious that, it didn't matter how good you got at Scope 1 and Scope 2 emissions if you couldn't tackle our supply chain. Now, obviously, a lot of that Scope 3 is still about energy, but a lot is about the stuff we do. It's the goods and services that we procure, and because of that, this is basically what we did as our strategic response to, really drawing on Laudato Si as a bit of a key guiding approach to us thinking about addressing climate change. So what we did was we sort of worked it out around 3 goals. And in a way, I often sort of think about it as, goal 1 is at the heart, or, if you had it as a circle, it's the circle in the middle. And the other 2 goals are really wrapping around it. And that everything depends on, that heading towards sustainable models of care. And just there, I'll let you have a bit of a look at that. But, we wrote a strategy that just went through every one of those, key points underneath for each goal as a sort of as a guide through for every part of the organisation to think through. And what that meant, every part of the organisation, I think Mercy's a bit unique. When you work in the hospital, you think there's just one of the hospitals, but actually there's the Institute of the Mercy Sisters in Australia and Papua New Guinea sort of oversee a number of services, including Mercy Health. And like many places, we have a board and an exec and a broad range of support services. And I've listed quite a few of them there underneath. And then there are 2 large acute hospitals, which is a bit of a focus for today, I think. There's Mercy Hospital for Women and there's Werribee Hospital, which function as not-for-profit Catholic hospitals that are part of the public hospital system. There's also 2 subacute hospitals in New South Wales, in Albury and Young. There's a whole range of community and healthcare services in mental health, in parenting, in palliative care. And then we have aged care services that sit across about 5 states. So it's a big organisation, and this strategy is for the whole organisation. We got a position statement and a vision, and Mercy didn't have one before. And one of the things that at the time I was really pleased to do was a commitment from the CEO and the board and the exec that our aim, rather than necessarily just saying, well, we'll be zero by whatever, it was sort of like a genuine commitment to doing everything that we possibly could in the next decade towards zero carbon emissions and properly trying to work out a strategy that could properly address all of the 3 scopes. How does that compare now? Because obviously, more recently, the AMA, the ANMWF and DEA have been talking about a reduction of 80% by 2030 and net zero emissions by 2040, which fits fairly closely with the NHS. And again, this is looking at all of the scope emissions. So I think we're all talking similarly, and I think they're enormously significant, serious goals to really advocate for. So this is I'll just very quickly take you through. So at the heart of the strategy, we put sustainable models of care. And so the strategy is written so that the hospitals have a whole section, aged care has a whole section, the subacute services and community care does. There's a section for every part of support services and also for the board and the exec. So it's sort of a little bit like a recipe book, but not really. There's plenty. It's really trying to give everyone autonomy to work within the areas that they can over a period of time. And I think we were all very aware at the time that we were really writing just a very big operational guide or a strategic guide, and that it was going to then need, and which is now what's happening, sort of action plans looking specifically at what to do each year, pulling out of this approach. But just to give you the feeling for it, these were that we just wanted everyone to start practicing thinking in this way wherever they worked. Is there a way they could move increase their focus on primary care and disease prevention? Just acknowledging that we are at the limits of peak health, pouring more and more of the GDP into healthcare with less and less good outcomes in health, and trying to shift us back, and which would have a huge effect on our Scope 3 emissions. Ensuring care is provided wherever possible in the least resource-intense settings, and it's been a good thing in a way with the challenges of COVID. Just to see, I think we've all been talking about that, how some of those things have been, developed and enabled overnight almost at the beginning of the pandemic. Also identifying, making changes to areas of care where we can use less resource for the same or improved health outcomes. Really advocating even in the strategy at the time for choosing wisely. And then the two others were about water and about green spaces, acknowledging the research that's gone on, saying that, how hospital stays are shortened with decent, proper green spaces, and also staff retention is so much better. So we've had our eyes glued to the work of the NHS and other good folks, and starting to understand, to almost develop a way of thinking that is just almost like a maths approach to this pie chart, and thinking, well, where will you eventually need to progressively put your attention? And clearly, pharmaceuticals and chemicals and medical equipment are an enormous part of this. And I think many of you are probably very aware of the graphs like this that have been coming out every year, getting prettier and prettier with every year, I think. The other one that we have been focused, we've used a lot to help people understand an approach, is just thinking through that that health is a good 7% of our country's carbon footprint, and that it's our hospitals and our pharmaceuticals that really have got a big lion's share of the contribution to that. And so really guiding any and should guide any strategy. So I'll just I will go a little bit more quickly through this now so we can get to talk about choosing wisely. I think the main thing was just how key procurement is, and all the parts of procurement, both in support services and just on the ground, and bringing into things, getting a commitment towards a triple bottom line accounting approach, which was the first time ever that got really seriously adopted as part of the strategy. The strategy was a year ago, just after the first year of COVID. The strategy was fully endorsed by the board and the exec, and getting from this stage to sort of a beginning of an operational plan has been really held up by COVID. I think that we've all struggled with that, but still, nevertheless, it's going ahead. I think all this is fairly obvious. I just wanted to show you the scope, I guess, and keeping strong social cohesion central to things. Thinking this is in the strategy, and it might not be what we tackle in the first year at all, but it's just acknowledging our direct responsibility to our Pacific neighbours, and particularly PNG and the Torres Strait. And I think that response will evolve as things progress. We've had a very strong equity and inclusion program, and I guess it was about making sure that was part of all this and that it got stronger. And that's just to show you, just very briefly, I can't just reproduce the document here, but it's just showing how, the steps, the key steps for the board to think through, including, the board and exec, including things like just thinking through superannuation companies and working with those companies that we use to shift away from fossil fuels, and similar sort of approach for the executive. And that's just showing you what it looked like, just as a sort of a stepping people through, depending on what part of support services they were from. That it's just it's a bit of a skeleton of ways to think through the important work. What's happened this year is now the strategy sitting under strategy and planning, and we are now looking at what will we tackle in all this for 2022. And so this is a draft action plan. And at the moment, the work is really thinking about governance and resource and across both support services and within the hospitals. So I guess that's what we're really focusing on at the minute. So I guess, what am I thinking now about choosing wisely, since I've been sort of carrying the idea for a few years now? I think there's so much work that all of you know is just absolutely fantastic. From, the thinking behind Evolve, I find so inspiring. The work of Alex Barrett and her team, Wiser Healthcare, is so central to a strategy like this. And I am so happy when I see all this good work being done by others, and that we can all, stand on each other's hands and shoulders. But I think that what we can start to look at is what aren't we looking at, and what's kind of not getting central stage, and could, and without too much shifting, maybe in choosing wisely. I think, and I think we can build on what's already being done. We will not be able to do a thing about Scope 3 emissions if we don't look at what care we're choosing, if we don't focus on sustainable models of care, and I think the work again of Alex Barrett about the value of care is key here, and working out an approach to Scope 3 emissions. Some of these, just briefly, a couple of these graphs I thought were worth showing you. This is from the NHS, and really it just shows that, most of those things haven't been able to, that the things that have changed a lot are the building energy and the water and waste. They're on the left-hand side, there's a bigger bar of it, and there's less on the right-hand side. And lots of the other things, the NHS is really starting to make inroads on all these things quite ambitiously now, because they could see that they just weren't budging, and we need to. And I think another way that the NHS graphically shows this is, the bottom ones are the two bottom graphs are the greenhouse gas emissions per inpatient, and there has been a significant drop over this period of time. But when you look at total greenhouse gas emissions, there's been one drop and then a plateau and another drop. But largely, what's keeping it there is just the number of inpatient emissions that that there still hasn't, in this period of time, still struggling to get that shift back to primary care, that it's about the number of people in our tertiary and quaternary services and everything. So I think, again, it's just highlighting what's needed. And then just looking at Alex's work again, I think this is a key area that choosing wisely could really start to draw on and continue to draw on, and develop a bit more of a practice, and in is the carbon footprint, particularly of low value care and harmful care, and that could be an enormous driver for us. And it's again, this is another one of the slides from that work showing, the carbon footprint of healthcare and dividing it in, 40% being our energy and 60% being really directly coming from clinical care, and what a difference we could make if we work with all those principles and pillars around care at the centre. So, and I think another area that I think, having worked on the strategy, that can just become embedded in our thinking. So I guess that's what I'm thinking, is things getting not forgotten and being embedded in our procurement. I was very keen for the work that we did around procurement to have our both our, to just everyone to start getting practiced and thinking, well, what's happening elsewhere from the things that we're bringing into the hospital. These are two very key examples that many of you will be aware of. That's, virgin rainforest in a part of Indonesia. That's there because there was a work by a number of key people trying to make the rest of us aware that many, many hospitals had a health purchasing agreement with paper that was just because it was the cheapest, because it didn't have a triple bottom line approach to what made, to the concept of whether it was cheap or not. And it turned out that the paper that many of the hospitals were using under that broad agreement and contract was all coming from Indonesian, old forest, just spelling it for paper. It's devastating. And the other image is a reference to Pakistan and the thousands of workers making the single-hand surgical instruments that then go from Pakistan to Switzerland and have final work done there. And again, the issues around the health conditions and the labour issues for the women, the children and the men working in those areas. And if any of you look into that more closely, it's a lesson in what not to do, really, as big big countries like Australia and the United States, who came in very heavy-handedly trying to reduce child labour, but didn't do any of it in a community development model that really improved the lives of the families and communities that were involved. So choosing wisely, 2022 and beyond. Well, take good care of choosing wisely. It's wonderful. It's inspiring, and as a grassroots initiative, its structure and approach makes it a powerful and effective tool for change. It is to me, it's one of the key effective concrete tools that will be able to drive change and help drive a strategy like the one that I've been involved in developing. It combines evidence and good thinking. It gives a strong structure to the on-the-ground initiatives, but still affords individual autonomy. I think all of us, we have quite a strong Choosing Wisely program at the Mercy now that's under the chair of Scott Simmons. And there's just so many people who are these fantastic change agents and who know exactly what should happen in their area of work, in ICU, in the ED, across obstetric care or whatever. And they're just ready to go and are doing this work. Choosing Wisely is evolving. It will continue to evolve. And I just watch it incorporating good evidence, good thinking and the issues of the day. I guess I'm just sort of offering now, though, that we could bring all our minds together to think more about these things that I've been talking about that we cannot afford to ignore anymore, and how choosing wisely might be able to develop in response to that. And so just finally, and I think, so there's a bunch of stuff around addressing climate change. There's a bunch of stuff around developing an approach to tests, investigations and treatment that take into consideration, these other big things. Often, you look at some of the life cycle analysis work that's been done by the key people that I've acknowledged at the end of this, showing that sometimes it can just be the waste around a farm, the packaging, that if we just get our heads around it, we can make a big difference. I think one thing Choosing Wisely could do is look at standardised evaluation and measurement tools to help everybody. And there's so much work we could organise around, circular economies and life cycle analysis to help that we're not all reinventing things in our own little areas. I think a big part of this is advocating for more funding. We're at the moment trying to look at a Choosing Wisely project officer and trying to scramble for some money to get going, and these project officers would just save so much money. And I think there's a leading up approach, funding in health that supports sustainable models of care, changes in our approaches to hospital accreditation. So I have finished. There you go. Thanks very much, everyone.
Thanks so much, Lisa, and thanks for sharing Mercy strategy on such an important topic as well. just quickly, if you have any questions, pop them in the Q&A or in the chat as well. And I might just get Scott. Today is Scott's last webinar. He's moving on to a different role. So I might just let him say bye and maybe just give an update on some of the environmental comments that came up in the Choosing Wisely annual survey as well.
Yep. Thanks, Anne-Marie, and thanks, Lisa, for a great presentation. And really bringing this issue to the attention and to these webinars, because it has come up in our annual survey that we do of our members and supporter organizations. And I think this has really made us think about how the linkages between Choosing Wisely and environmental sustainability. And it's something we're certainly considering how we can enable and continue this dialogue on this issue, and hopefully enable more or support more of the Champion Health Services and the colleges to consider, both in the development of recommendations as well as implementation, how we can demonstrate that we can have a double bottom line, I guess, for Choosing Wisely, and showing that Choosing Wisely can be implemented and reduce unnecessary care, but we can also be reducing emissions and carbon footprint at the same time. So thank you all. I've really enjoyed my time here at Choosing Wisely. But yeah, a new opportunity arose, and so I've decided to pursue that. So next week will be my last week at NPS Medicine Wise and working in Choosing Wisely. Anne-Marie will still be around. She'll be your main contact, particularly for Champion Health Services. And also, we're recruiting for the Choosing Wisely lead role. So if you know anybody who may be interested, check out NPS Medicine Wise's website for the position description.
Thanks, Scott, and thanks, Lisa. So one of the things I thought that's worth mentioning is some of the health services have started to report on evaluation outcomes as well as part of the projects. So if you have anything in this area, we would love to showcase it, because I think the more we get the word out there, then the more we're able to make a difference in this space as well. And just some comments in the chat for you, just saying great work, Lisa. Thanks for a great presentation. There is one question there. In order to help with measuring and benchmarking a different way to look at value, carbon literacy training would be important. Would Choosing Wisely be able to put forward consideration of trying to include training for clinicians to measure carbon in the models of care?
Can I make a little comment about that? I think there's so many things just to get a group of people to progressively think about what's the best way to approach some of this stuff. And, whether it is that we really fight all out for a national sustainable development unit and sustainability development unit, or something that then, things like Choosing Wisely can feed into, or where we're thinking about standardised approaches to measuring carbon footprints in hospitals, where it's crazy, isn't it, when you've one hospital like us and you're just trying to think, gosh, we're right now thinking, how are we going to measure this? And but so is everybody. But I think these are big conversations, and we really need to come together and then develop training from these models of care, Choosing Wisely projects that can have all this thinking embedded in them. But how are we going to measure and help people? And I think it's all entirely doable, but it's a big thing that'll need a lot of brains. But the work's out there, and there's people, who are part of our colleagues who are really getting good at this stuff.
Yes, definitely. And if you do know of anyone who's passionate about this in this area and would like to run training sessions, we can coordinate it centrally and see who's interested as well. Yeah.
I think that's a huge thing that would be wonderful to do.
Yeah, definitely. Okay, thanks again, Lisa. And Scott, did you have anything else to add? You've come off mute.
I was just going to say that one of the strengths, I think, of Choosing Wisely is, this broad network of organizations. And, I think where our role at NPS is in trying to coordinate that. And so whether that's running a training or putting together a toolkit, I think the more that you all are able to share with us, then we can help package that up or facilitate the discussions and stuff so that we can, and then disseminate that more broadly. So please share with us what you're doing, how you're measuring things. And what your priorities are in this space so that we can help pull that together and share it.
Yeah, absolutely. Yeah. No, well, thanks and all the best.
Right.
Thank you.
Thank you. And Scott, Emily's left a comment as well, so about a toolkit. So we'll take that into consideration. All right. Thanks, everyone. Have a great rest of the week.
Yeah. Thank you, everyone.